My name is Mwesiga and I am the Programs Manager at the Palliative Care Association of Uganda. The Palliative Care Association of Uganda is the umbrella organization for all palliative care providers in Uganda. Uganda has been hailed as a model of palliative care service provision in Africa and indeed globally. The Worldwide Palliative Care Alliance in 2014 classified Uganda among the countries where advanced integration of palliative care into the main service provision had taken place. Again, in 2015, the Quality of Death Index ranked Uganda second in Africa, after South Africa, as a country where the quality of death had greatly improved. In Uganda, 90% of the districts have a form of palliative care. These achievements are greatly attributed to the fact that specially trained nurses in our country are allowed to prescribe oral liquid morphine. Now, before 2004, nurses in our country were not allowed to prescribe opioids except for midwives who were allowed to prescribe pethidine for mothers in labor. The champions then, of course, among them, Dr. Anne Merriman, the founder of Hospice Africa Uganda, succeeded in their ask from government, and the government issued a statutory instrument that allowed nurses to prescribe certain opioids, including oral liquid morphine, for pain relief among palliative care patients. In our country, the doctor-to-patient ratio still stands at one doctor for at least 20,000 people. Of course, if only doctors were prescribing up to now, it would still be a challenge for patients to access pain medication. So this is why Uganda has been a model of palliative care service provision in Africa, because of that task shift that allowed nurses to prescribe. In 2015, a law was passed, the Narcotic Drugs and Psychotropic Substances Control Act, that does not explicitly state the instrument which was passed in 2004 that allowed nurses to prescribe morphine. This new law talks about medical practitioners being the only one legalized or allowed to prescribe opioids. Now, it does not explicitly state that the instrument was revoked or removed, but it is not clear whether the instrument that was passed in 2004 is still in force. So this has brought in some panic among some palliative care providers, and the palliative care advocates in Uganda have again come together to advocate that the principle of due balance should be respected in our country, that the balance to balance the control of the opioids such that there is access for medical and scientific use for these opioids to be used in our country. So the champions, the palliative care advocates, are again up and they are advocating for the following. And this is what we are saying, that there is need to fast track these regulations for the implementation of the new act. And the instruments, the regulations for the new act should champion the principle of due balance, that these regulations should streamline the conflicting provisions to balance the control and use of opioids for medical and scientific purposes, that the regulations for the new act should explicitly state out the purpose for which the 2004 statutory instrument that allowed nurses to prescribe morphine was put in place, because this was for the purpose of ensuring that there was access to controlled medicine for people who are suffering in pain in our country. In the meantime, we advocated to the Minister of Health and said that they should obtain a clarity from the Solicitor General to make sure that indeed the new act does not conflict with the statutory instrument that was passed in 2004, and that the palliative care providers can continue to provide these services. The nurses can continue to prescribe oral liquid morphine when they are not hampered with. In Uganda, like in many other developing countries, the need to access controlled medicine for pain relief is still high. For example, the Uganda Cancer Institute has stated that 75 to 80% of all the patients that come for diagnosis at the Cancer Institute report with stage 3 or up to 4 cancer. Now, this means that other therapies apart from palliative care may not be helpful to these patients. So there is a need for pain relief to be accessed for pain medicine to be accessed. We cannot talk about universal health coverage when we still have legislation or laws that impede the access to controlled medicine. It is high time that all countries work towards ensuring that there is access that is not hampered with by controlled medicine in our countries. I thank you.